Hey guys, Don here. Welcome to Podiatry Practice Mastery, where I'm trying to help you get your practice to the $1 million mark and beyond. And this has been a fun time. I want to talk a little bit today about Shockwave. Now, Shockwave, a lot of people that join my Practice Mastery Academy like Shockwave. There's recently a doctor that joined. He has a Shockwave, does it very similar, and I was intrigued. I'm going to be going to the upcoming Shockwave conference here in Boston, and I always learn a lot at these conferences. And I was doing something the other day in the office. I was doing this procedure, this KeryFlex procedure, where you put on this fake toenail, and I think it looks great. And it took me about a half hour to do two nails. And as the patient was checking out, she was complaining about the price. So I think the price was, I did $125 for the first nail and $50 for the second, so it was $175. And then she bought the kit. I think it was $60, so $222, something like that, under $250. And then I thought to myself, man, I should just be stopping doing this KeryFlex, and I should just do Shockwave, because I never have anyone complain when they're paying $250 for the Shockwave. And I know the KeryFlex, they do it every 6 months or whatever you do, but the Shockwave, you do 3 to 6 sessions, and it really gets them better. And so I have talked to a couple of other doctors, and there was a doctor recently, I had an interaction with him, and I was like, he does a lot of Shockwave, and then you can use it on other areas. So there are some other doctors that are doing Shockwave on other areas, so you can use it on the knees, on the hips, and tennis elbow. I guess you could do ED if you wanted to. I wouldn't want to do that in my office. But what about these other areas? And I know there's a doctor that what he does is he Monday through Friday he has his podiatry practice and does a lot of Shockwave. And on the weekends he has a chiropractor there, or he even recommended like a massage therapist there that could do other body parts. I know it might confuse a little bit of the clientele, but if it works, it works. So if you could do it on knees or if you could do it on hips, you would get someone else to come in and do it. I've even thought about having such as like a athletic trainer, because you could train them how to do it and they could do all these for you. If I were to do Shockwave again, part of it is my practice dynamic. Right now we all kind of do it, and I feel okay because it's at a price point where I feel like it is profitable, but it does take a lot of time. So some days I have 4 or 5 Shockwaves, which is a lot of office visits that I could be seeing new patients with. Part of it is you want to, they're paying a lot for it, you want to make sure they're getting it, you're adding amnio to it, other things like that, which is different. So what this doctor does is, so he is able to do in his office on the weekends, he can do other body parts because of another provider that's there. And so just something to think out of the box. If you have a Shockwave and you separate some other days to do other body parts, you could do that. Or I guess you could rent it and bring it to someone else's office, but it's probably easier to have them bring their patients to your office, or you then offer it to the patients to have them come in for the Shockwave. I think it really works miracles. I don't even know if I could practice anymore without it. I've gotten so used to the Shockwave. Once again, I do not get paid by Shockwave, but it really is a great modality that's really worked for me. So that's how you can use Shockwave to add more revenue, having other people do it. So if I could do it over again, and if you're considering about getting Shockwave, I would certainly go to conference, number one, and I go every year just to stay up with it. Number two, I would do a deep dive on the whatever training you have for whatever machine you get. So I have a KeryFlex, and on their website there is some deep training, and I would just binge watch everything, because the more that you watch, the more that you learn. There was a recent one I watched on ultrasound and how that is affecting the location of doing it, but I did find it helped me to do better at ultrasound as well, which I always do before the Shockwave. So that's another thing that I would do. Third, I guess if I haven't mentioned before, I would get an ultrasound. I could not do half of what I do without the ultrasound. I think the ultrasound really is what helps patients to understand the importance. You show them the right side and then the left side, and you show them the difference in the anatomy. And it's the ultrasound all day long that helps my patients understand that they would benefit from Shockwave, and also that they would benefit from the amniotic stem cell injection. So those are kind of the main high points in terms of doing Shockwave. I know certainly people say, it's a kind of an expensive machine, this and that, but I found that it really works well. It takes time. I think a lot of it is their expectations. So, for example, I had a a patient that came in from a physical therapist, and they had a Shockwave machine, and they came in and they had the treatments. I thought it was totally fine, and I recognized that. I'm not going to talk bad. I think it's an excellent machine. But they came in like 2 or 3 weeks after that. And what I feel like is the PT didn't give them the expectations of how long it takes for this stuff to work. Like, I find it starts to work at about 6 weeks, and depending on the anatomy, you might need more sessions. Like, the ones that need a lot, in my opinion, are like insertional Achilles tendinopathy and Haglund's and things like that. They need more sessions because of the tissue. I find that straight non-insertional Achilles, plantar fascia that hasn't been there that long might do 3 or 4 sessions, but the other ones need more sessions. So it's not that it doesn't work; it just takes more time. And the way you can tell that is with the ultrasound. So those are my ultrasound and Shockwave tips. If you want to learn more, there is other kind of podcasts about this topic. There's also kind of a couple of masterclasses within the Practice Mastery Academy. And in there you'll see stuff on Shockwave, on ultrasound, on all these things, kind of things that actually work in the practice. Once again, if you have any questions, shoot me an email, don@podiatrypracticemastery.com. I always like getting comments and questions and things like that.